Let me ask you something. When you got into bed last night, which way did you lie down? On your back? On your stomach? Curled up on one side? Did you think about it at all? Or did you just collapse into whatever position felt comfortable and close your eyes? Most people treat their sleeping position the way they treat breathing. It's automatic, unconscious, not worth a second thought. But what if I told you that the position your body is in for 7 or 8 hours every single night has a direct, measurable effect on your heart, your brain, your blood pressure, and your risk of stroke? What if I told you that one position in particular protects you from cardiovascular damage in ways that most people, including many doctors, rarely discuss? And what if I told you that millions of people over 60 are sleeping in the single worst position for their heart every single night and have no idea? I'm Dr. Kevin Adewale. I'm a cardiac surgeon. I've spent over 20 years repairing the damage that happens when the cardiovascular system fails during the hours nobody is watching. The hours between midnight and 6 in the morning, when strokes strike, when hearts stop, when the consequences of decades of small decisions finally arrive. Tonight, I'm going to tell you the position that protects your heart and your brain while you sleep, and I'm going to show you the science behind it. Not vague wellness advice, real research, from real institutions, with real implications for your life. Stay with me. This is one of those conversations that cost you nothing to hear but could change everything. The most dangerous hours. Before we talk about position, you need to understand why the night matters so much. Your cardiovascular system does not shut off when you fall asleep. It shifts into a recovery mode. In a healthy body, blood pressure naturally drops during sleep, usually by 10 to 20%. Your heart rate slows, your arteries relax. This nighttime dip is not a luxury. It is essential maintenance. It is when the lining of your blood vessels repairs itself, when inflammation is cleared, when the heart muscle recovers from the demands of the day. But after 60, this system becomes less reliable. The arteries stiffen, the blood pressure regulation weakens, the margin for error shrinks, and the hours between midnight and 6 o'clock in the morning become the highest risk window for heart attacks and strokes. Not the afternoon, not the morning commute, the quiet hours, the hours when you are lying still, unconscious, while your body runs on a skeleton crew. What happens during those hours depends enormously on factors you set before you close your eyes. The meal you ate, the medication you took, the temperature in the room, and as we are about to discuss, the position your body is lying in for the duration, the position that puts you at risk. Let me start with what to avoid, because this is the most urgent part. Sleeping on your back, what doctors call the supine position, is the single most damaging position for a significant percentage of people over 60. And here is why. When you lie flat on your back, gravity pulls the soft tissues of your throat, including the base of your tongue and the soft palate, downward and backward. In a young person with firm tissue and a wide airway, this may cause nothing more than mild snoring. But in an older adult, particularly one who is overweight or who has any degree of airway narrowing, this gravitational collapse can partially or completely obstruct the airway. That obstruction is sleep apnea. And I need you to understand what sleep apnea does to your cardiovascular system, because it is one of the most under-recognized sources of heart damage I encounter in my practice. During an apnea episode, you stop breathing, sometimes for 10 seconds, sometimes for 40 seconds or longer. Your oxygen levels plummet. Your brain registers a crisis. Adrenaline surges. Your heart rate spikes. Your blood pressure rockets upward. Your heart essentially jolts awake to restart breathing while the rest of you remains asleep. And this happens over and over, 30, 40, 50 times per hour in severe cases. Now imagine that assault on the cardiovascular system, night after night for years. The data is unambiguous. Sleep apnea is associated with a dramatically higher risk of high blood pressure, atrial fibrillation, heart failure, and stroke. And according to the American Heart Association, it affects approximately 34% of middle-aged men and 17% of middle-aged women, with the majority of cases going completely undiagnosed. Here is the critical fact that connects all of this to your sleeping position. Research has consistently demonstrated that sleep apnea is significantly worse in the supine position. For many people, the breathing disruptions occur almost entirely while sleeping on their back. This is so well established that there is an entire clinical category called positional obstructive sleep apnea, defined as sleep apnea that is at least twice as severe when lying face up compared to lying on the side. Studies have shown that simply shifting from the supine position to the lateral position, sleeping on your side, can reduce the severity of apnea episodes, improve oxygen levels, and measurably lower blood pressure. One study found that patients who avoided back sleeping showed a significant reduction in blood pressure, directly attributable to the reduction in apnea severity. A 2024 study, using data from the Sleep Heart Health Study, a major prospective cohort study, found that people who spent more time sleeping in the supine position were more likely to experience cardiac symptoms during the study period, even after adjusting for age, weight, stress, and blood pressure. The supine position has also been directly linked to the development and worsening of heart failure and to worse outcomes following stroke. If you are over 60 and you sleep on your back, you may be handing your cardiovascular system its heaviest burden at the exact moment it is least prepared to handle it. The position that protects you, the position that the research increasingly points to as the most protective, is the lateral position, sleeping on your side, and the benefits go far beyond sleep apnea. In 2015, a landmark study published in the Journal of Neuroscience by researchers at Stony Brook University and the University of Rochester changed how neuroscientists think about sleep and the brain. Using dynamic contrast MRI, the researchers examined a system called the glymphatic system, a network of channels in the brain that acts as the brain's own waste removal system. During sleep, this system clears toxic metabolic byproducts, including amyloid beta and tau proteins, the very substances that accumulate in the brains of people who develop Alzheimer's disease, and that are increasingly implicated in stroke-related brain damage. The researchers tested how efficiently this waste clearance system operated in 3 sleeping positions: supine, prone, and lateral. Their finding was striking. Glymphatic transport, the brain's ability to flush out these harmful proteins, was most efficient in the lateral position. Side sleeping cleared brain waste more effectively than sleeping on the back or the stomach. The lead researcher stated clearly that the lateral position was consistently associated with the most efficient glymphatic transport compared to the other positions. The researchers proposed that the prevalence of side sleeping across humans and most animals may have actually evolved specifically to optimize this waste removal process during sleep. Think about what that means. While you are lying on your side, asleep, your brain is running its most effective cleaning cycle. It is flushing out the proteins that, if they accumulate, contribute to cognitive decline, dementia, and the vascular damage that sets the stage for stroke. When you lie on your back, that process is less efficient. When you lie on your stomach, it is even worse. Neurologists have confirmed this connection. Researchers have noted that sleeping on the side can improve cerebrospinal fluid clearance, and that this clearance process occurs primarily during sleep. While the research is still developing and direct cause and effect conclusions in humans require further study, the association between lateral sleeping and more effective brain waste removal is one of the most compelling findings in sleep neuroscience in the past decade. Now combine this with the sleep apnea protection. In the lateral position, your airway stays more open because gravity is no longer pulling the soft tissue straight back into the airway. Apnea episodes are reduced or eliminated. Oxygen levels remain stable. Blood pressure stays lower. The heart is not being jolted awake dozens of times per hour. And simultaneously, the brain's cleaning system is operating at peak efficiency. One position, 2 powerful layers of protection. Your heart and your brain guarded simultaneously. Left side or right side? This is the question everyone asks, and the answer is more nuanced than most people expect. Let me give you what the science currently says. For most healthy adults, either side provides the core benefits I've described. Both sides keep the airway open. Both sides allow the glymphatic system to function more efficiently than the supine position. If you are a healthy person over 60 without specific heart disease, either side is a significant improvement over sleeping on your back. However, there are differences that matter for specific conditions. Sleeping on the left side has been shown to reduce acid reflux. A 2022 study found that left-side sleeping was associated with significantly less acid exposure in the esophagus and faster clearance of acid from the esophageal lining. This matters for the heart because chronic acid reflux has been associated with increased cardiovascular risk, and the symptoms of severe reflux can mimic and even trigger cardiac symptoms. If you suffer from GERD or frequent heartburn, the left side may offer an additional layer of protection. However, for people with heart failure, there is a meaningful difference. Research published in the Journal of the American College of Cardiology found that patients with congestive heart failure spontaneously avoided sleeping on their left side. The study of 75 patients showed that those with larger hearts, higher lung pressures, and reduced cardiac output spent significantly less time on their left side compared to healthy controls. Why? When you lie on your left side, the heart shifts slightly due to gravity and presses closer against the chest wall. In a healthy person, this is completely insignificant. But in someone with an enlarged or weakened heart, this repositioning can increase the sensation of the heart beating against the chest, cause discomfort, and in some patients, increase sympathetic nervous system activity, essentially putting additional stress on an already struggling organ. For people with heart failure, the right side is generally more comfortable and may place less mechanical stress on the heart. Many heart failure patients also benefit from sleeping with the upper body elevated, using a wedge pillow or adjustable bed to keep the head and chest higher than the abdomen. This elevation helps prevent fluid from accumulating in the lungs, a common and distressing symptom of heart failure. So let me simplify this. If you are a healthy adult over 60, sleep on your side, either side. If you have acid reflux, favor the left side. If you have heart failure or an enlarged heart, favor the right side, and consider elevating your upper body. And regardless of your condition, avoid sleeping flat on your back. How to actually change your sleeping position. Now I know what you're thinking. You've slept on your back for 40 years. You can't just decide to sleep differently. You fall asleep one way and wake up another. Your body has a mind of its own. I hear this from my patients all the time. And you're right, it is harder than it sounds, but it is not impossible, and the strategies are simpler than you might expect. The first and most well-studied technique is the tennis ball method. You take a tennis ball and sew it or tape it into a pocket on the back of your sleep shirt. When you roll onto your back in the middle of the night, the discomfort wakes you just enough to shift back to your side. It sounds crude. It works. Studies have validated this approach as a legitimate form of positional therapy for sleep apnea. There are also commercially available devices. These are used clinically for positional sleep apnea, and they are effective. A body pillow placed along your back can prevent rolling. Hugging a pillow in front can help maintain a comfortable lateral position. And a pillow placed between your knees keeps your spine aligned and reduces hip and lower back strain, which is one of the main reasons people unconsciously roll to their back in the first place. Discomfort. The key is this: you don't have to maintain perfect side sleeping all night long. Even reducing the amount of time you spend supine makes a difference. Moving from 60% of the night on your back to 20% of the night on your back can meaningfully reduce apnea severity, improve oxygen levels, and lower the cardiovascular burden your heart carries through the night. The Heart-Safe Sleep Blueprint. Let me put it all together for you. A complete blueprint for how to sleep in a way that protects your heart and your brain. Choose your side. If you are healthy, either side works. If you have reflux, go left. If you have heart failure, go right. If you snore heavily or have been told you stop breathing in your sleep, getting off your back is the single most important change you can make tonight. Elevate if you need to. If you have heart failure, shortness of breath, or swelling in your legs, sleep with your upper body elevated at 30 to 45 degrees. A wedge pillow is the simplest solution. Support your body. A pillow between the knees. A body pillow behind the back. A comfortable mattress that doesn't create pressure points. Comfort is not a luxury here. It is what keeps you in the protective position all night. Set the room between 18 and 22 degrees Celsius, 65 to 72 Fahrenheit. A room that is too warm increases heart rate, promotes dehydration, and disrupts the deep sleep stages where the glymphatic system does its best work. Drink a glass of water before bed. Dehydration thickens the blood and increases clot risk during the hours when circulation is at its slowest. And if you snore, if you wake exhausted, if anyone has ever told you that you stop breathing in your sleep, pursue a formal evaluation for sleep apnea. This is not optional. It is cardiac care. What I want you to understand, I want to be honest with you, not as a content creator, as a surgeon. The research on sleeping position and cardiovascular health is still developing. We do not yet have a decades-long randomized controlled trial that definitively proves one position prevents heart attacks while another causes them. Medicine does not work that way, and anyone who tells you otherwise is oversimplifying. But what we do have is a growing body of evidence from major institutions, from the Journal of Neuroscience, from the American Heart Association, from the Sleep Heart Health Study, that consistently points in the same direction. Side sleeping reduces sleep apnea severity. Side sleeping appears to improve the brain's waste clearance system. Back sleeping worsens airway obstruction, raises blood pressure, and is associated with worse cardiovascular outcomes. The signal is clear. The risk of acting on it is zero. The potential benefit is enormous, and the cost is nothing more than turning over. I have operated on hearts at 3 in the morning that were damaged by years of undiagnosed, untreated sleep apnea. I have spoken to families in hospital corridors who had no idea that the snoring they joked about for years was a cardiovascular emergency happening in slow motion. And I have read the research that shows a simple change in body position during sleep can reduce the very mechanisms that led those patients to my operating table. You now have that information. The question is what you do with it tonight. Tell me in the comments below. How do you sleep? On your back? On your side? Have you ever been told you snore or stop breathing? I want to hear from you, because I suspect many of you will recognize yourselves in what I've described tonight. If this video helped you, share it with someone who sleeps on their back. Share it with someone over 60 who snores. Share it with someone who has never once considered that the position they sleep in could be quietly shaping the future of their heart. Take care of that heart. Give it the position it needs to rest, recover, and keep going. One last thing. Everything I've shared here is general medical information based on current cardiovascular and sleep research and my own clinical experience. It is not a substitute for your personal medical care. If you suspect you have sleep apnea or any sleep-related breathing disorder, please talk to your own physician and pursue a formal evaluation. That's not a legal disclaimer. That's genuine advice from someone who wants you still watching this channel, healthy and well for many years to come. Good night. Turn on your side. Take care of yourself.